Biomarker analyses are a set of techniques used to identify and measure specific molecules or characteristics that can indicate the presence or progression of a disease or physiological state. Biomarkers can be found in various biological samples, including blood, urine, and tissues, and can be used for diagnosis, prognosis, and monitoring of disease progression and treatment response. Biomarker analyses involve the identification and quantification of specific biomolecules or characteristics that are associated with a particular disease or physiological state. For example, in cancer diagnosis, biomarker analyses can be used to detect specific proteins or genetic mutations that are associated with the development and progression of cancer. Similarly, in cardiovascular disease, biomarker analyses can be used to detect specific proteins or other molecules that are associated with the risk of heart disease. Biomarker analyses can also be used to monitor disease progression and treatment response. For example, in cancer treatment, biomarker analyses can be used to monitor the levels of specific proteins or genetic mutations that are associated with the response to chemotherapy or other treatments. This can help doctors adjust treatment plans and improve patient outcomes. There are various techniques used for biomarker analyses, including immunoassays, mass spectrometry, and genomic sequencing. Immunoassays use antibodies to detect and quantify specific proteins or other molecules in a biological sample. Mass spectrometry is a technique that can identify and quantify a wide range of molecules based on their mass and charge. Genomic sequencing can be used to identify genetic mutations or variations that are associated with disease. Biomarker analyses have numerous applications in medicine and healthcare. They can be used for early detection of diseases, monitoring of disease progression, and assessment of treatment response. They can also be used to identify individuals who are at high risk of developing certain diseases, allowing for early intervention and prevention. However, biomarker analyses also have some limitations. Biomarkers can be affected by various factors, such as age, sex, and lifestyle, which can affect their accuracy and reliability. Additionally, biomarker analyses can be expensive and time-consuming, and not all biomarkers are equally effective for all diseases or conditions. In summary, biomarker analyses are a set of techniques used to identify and measure specific molecules or characteristics that can indicate the presence or progression of a disease or physiological state. They have numerous applications in medicine and healthcare, including diagnosis, prognosis, and monitoring of disease progression and treatment response. While they have some limitations, biomarker analyses remain a valuable tool for improving patient outcomes and advancing our understanding of disease.